Good evening, everyone, and thank you for joining me here on another Facebook Live broadcast. This is our first in some time, and a lot has happened these last few months. I hope that everyone was able to have with limitations and all, a really a good and hopefully a pleasurable time over the Christmas period and the New Year. A very difficult time for all of us, of course, and the idea for tonight is, as will be the case in the next while, as we go through this winter, every few weeks or so, I'm going to bring some updates as things evolve in this pandemic that we're living with on a number of different fronts. But I just want to thank you for taking the time to join me tonight, and we're going to kick the program off to talk a little bit about what we're going to be doing this evening. Really, sort of three main topic areas. The first is going to be on an area of programs that started last fall, but in light of this second wave, may be in particular these more stringent lockdown and restrictions that have been put in place as of last night, I guess, at midnight. There may be people affected by job losses due to business closures and things like that. So we're going to review where those income supports are for programs like the Canada Recovery Benefit and EI. Secondly, we're going to talk a little bit about the travel restrictions that are in place as far as people coming into Canada or potentially leaving, how that's done, and the best place to get information on how to do that properly. And thirdly, we're going to talk about the issue around vaccinations. I mean, we're watching the vaccination rollout. I want to talk to you just briefly about, what the federal government role is in all of that. It does have a role to play, and but works very closely with the provinces to do that. So that my hope is that the front end presentation of those three topics will probably take about 30 minutes or so, maybe slightly more than that. And we'll take it at a good pace. So hopefully, as you follow along, keep note of any questions you have, and we have a period after that presentation time where I'd be glad to hear your questions on any of the topics that we cover tonight. But also, if you think of something on a different related topic, don't hesitate to plug that in as well. So I'm going to turn over to Curtis Schluter. Curtis is my executive assistant here in the riding, and he's going to explain how to get your questions recorded for tonight's show.
Yes, thank you, Bruce. So, as with all of our previous town halls, we do that Q&A period right at the end. So at any point throughout the broadcast, all you need to do is just drop your comment in the comment section of this stream, and we'll make sure we get that over to Bruce. Typically, we get to about 10 or so questions throughout the broadcast, so don't worry if we don't get to your question. We will follow up with you afterwards. And just as an additional thing, we'll ask that you keep the questions as brief as possible, and just make sure you're not putting in any personal detail that might expose you to any sort of privacy risks. But yeah, that's pretty much it. So we'll pass it back over to Bruce.
Thanks very much, Curtis. And so let's jump into our first topic. As I alluded to, there may be changes in circumstances for people who are looking for income support because their businesses are closed, their jobs are shut down until things open up again with COVID and the pandemic. So there's essentially, many of you will remember there was a program called CERB, the Canada Emergency Response Benefit, for many months back in the earlier part of 2020. That operated right through until almost the end of September. And after the 27th of September, that program essentially transitioned into two separate paths. One, EI, which you'll all be familiar with, the Employment Insurance Program, and the secondly, for people who weren't eligible for EI, a new program called the Canada Recovery Benefit. So I want to talk briefly about EI first of all. So EI, for people who are still unemployed, not able to work because of COVID, but if you have at least 120 insurable hours in the last 12 months, you will be eligible for EI. So that will pay at least $500 a week, the same as what you were getting with CERB, and it'll be a benefit that you can apply for online using your My Service Canada account. We recommend that you go there first to try if you think you're eligible for EI, even if you're not so sure. Try that first and see if that's going to work for you. If in the course of that application you come across a message that says, unfortunately, based on your situation, you're not eligible for EI, you would then proceed to the second potential path, and that's called the Canada Recovery Benefit, or CRB, and that's available also on online. It's an online application through the Canada Revenue Agency, CRA. That's the same agency that you would have if you used the CERB program earlier or in 2020. You would have gone through your CRA, my CRA account to try that. So just those are the two paths to try. If you VI doesn't work, and then you go to the CRB program and you get a message to say that's not you're not qualifying or eligible for that either. We've come across and we've heard from a number of people here in the riding who have said, I can't apply for CRB because they're telling me that I'm still registered with EI. So true enough, what has to happen there is for in some cases, people who have had previous benefits under EI will not be able to proceed into the CRB stream until they kind of get a release from EI. EI literally has to send them a letter to say, we've terminated or discontinued your status within EI so that you're then free to apply to the CRB program. So we can help you with that letter. But if that happens to be the case, you can try getting a hold of Service Canada to do that. They're sometimes difficult to get a hold of. Give us a call here at the office. We have our numbers at the end of the show, and we'd be glad to help you with that. So that gives you an idea of the two programs that are out there for income support for people who have not been able to, or jobs are or discontinued or temporarily laid off because of business closures and the like. So those are some programs to take a look at, and again, we're always happy to help you with that. Now let's go to our second topic, and that's on the issue of travel. Now there's been a lot of interesting travel news around people traveling out of country. Some controversy with people in public offices who traveled out of country at a time when effectively we were, all governments were saying, hey, stay home. Travel outside of country is not recommended. It's all about, really preventing the spread of COVID-19 and finding ways so the least exposure that we have to that kind of connection, the better it's going to be, the safer it's going to be. So right out of the gate, when it comes to travel, unless it's essential, the recommendation is that you postpone any travel outside of Canada for the foreseeable future until we see the situation internationally and even here in our country improve. But if you must go, and there are some situations where, if you're an essential worker, there's necessities around travel across the border. If you're going to the United States, you can't travel into the U.S. Unless you're for a non-essential reason at a land border, but you can fly to the United States. So you can book a flight to the U.S. even for recreation or leisure. Again, we don't recommend that, but if you had to go to visit or go to a funeral or something like that, nothing stops you from getting on a flight and going to the U.S. Of course, you've got to have the right documents and all that, but that's assumed. But certainly driving across the border, that's not going to be permitted for non-essential travel. If you're in the United States now and are traveling back, you can fly back certainly, but you can also, if you've got a car down stateside and you're traveling back across the border, you're a Canadian citizen, you're not going to be denied entry into Canada, but there may be some stipulations based on your circumstances that I'll get into in a few moments. One of the key things there, anytime you're traveling out of country, we always recommend going to the travel.gc.ca website. This is an amazing source of good information. Same with respect to COVID and crossing the border. Canada Border Services Agency, and travel.gc.ca. If you slip a COVID-19 into your Google search there or whatever search engine you use, it's going to take you to some really valuable information that really steps you through the various restrictions on travel going to and from Canada. So have a look at that. I want to take you now to the for those who may be flying outbound and wanting to come back to Canada. Just last week, actually a week ago today, the government implemented a new requirement so that when you are coming to Canada, that's all travelers, whether you're a Canadian or a foreigner, if you're traveling into Canada, you have to get a COVID test within 72 hours of the departure of your flight. So they will not let you get on the airplane unless you have had that COVID test. And if it's a negative test, of course, then you're going to be able to board your flight, come to Canada, no problems at all. But if you've got any kind of symptoms, or if you have COVID, you will not be allowed on that flight. So that's 70 to 72 hours. When you get to Canada, the document that you get that shows that you're negative, you need to hang on to that for at least 14 days. And you should know also if you're traveling with a family, kids under 5, so 4 years and under, do not have to have the COVID test. So that's just something to know, especially for people who are traveling outbound now, who may be coming, you'll have to make arrangements at the destination to make sure you get that COVID test done. Now let's swing over to just a few more things with respect to travel. Once you get into Canada, it basically splits this way. You either have no symptoms or you potentially have COVID-like symptoms or COVID itself. So if you have no symptoms, there's really no worry there. You can go from wherever you land in Canada to your home destination, wherever it is that you're going. But you still have to make sure you quarantine for 14 days. That 14 days is still a requirement, and border officials will be asking you whether you've got all those arrangements in place. You'll have to show them. You'll have to give them contact information. They will check on you to make sure that you've got the proper arrangements in place to quarantine for 14 days. If you have symptoms, if you have COVID or symptoms and you're a Canadian, obviously you're going to be able to get to your destination, but you're probably going to have to go into isolation, and that's one step up more from quarantine. You're going to have a more rigorous isolation plan, and if you don't have an isolation plan, you may even get put into a federal isolation type facility, a hotel that's set up by the federal government to make sure that you stay in isolation for 14 days. Literally, that is where it's at right now. If you don't have a proper plan or arrangements in place and you have COVID or you have COVID-like symptoms, you're going to be put in isolation one way or the other. So have that plan sorted out. Make sure you've got those arrangements in place. If you're a foreigner coming to Canada and you've got COVID or COVID-like symptoms, you're not getting in. Period. Okay, you're obviously not going to be able to get on the flight to get here, but if you essentially show up at a land border crossing, and even if you're an essential worker, you're just not going to get into the country unless you are without symptoms or COVID. That's just the way it's going to go under any of those circumstances. One other point on this is that when you come to Pearson, if you're flying back to Pearson and you've got everything done, you've got your negative COVID test, you show up at the airport, you've gone through customs, you've got your or quarantine plan all sorted out. You have the option of doing a voluntary COVID test. There, the province of Ontario last week set up a pilot program where you can get a COVID test right at the airport to make sure that you're okay. So, and that's free, by the way. Now, related to travel is the issue of passports, and I wanted to just pass along to you this evening that Passport Canada is really essentially shut down right now. There's obviously not a lot of travel, but you should know that you can still get your passport renewed if you absolutely need to, even for non-essential travel. While their staffing is much more reduced right now, there's no in-person services for Passport Canada, including at our offices here. I'll talk about that in a moment. But the Passport Canada services, if you like, let's say an emergency trip, you had to go You're permitted to go because it's essential travel, and you have to get a passport. You can get one within 2 days by calling Passport Canada 800-567-6868, and they will find out what the circumstances are, set up an appointment with you, likely in Toronto, and you can go and get your passport within 2 days. So that is there for you. If you want to renew your passport, and if your passport has essentially expired, any passport that has expired after February of 2019, you can get it renewed using the regular simplified form, which means just you need a new photo and you need your old passport, your passport that has expired. You fill out that form, mail it in, and Passport Canada will send you out a new passport. I should add in that, I mean, our offices are on limited services ourselves right now, but we would be happy to, while we can't do it in person, we'd be happy to talk to you over the phone. Just go over your passport before you mail it in. We can literally go through it line by line, make sure you got all your stuff together, and then mail it off to Passport Canada, and you'll be all set to go. So that's something to keep in mind as we get hopefully ready for a season where we can travel again, and hopefully that won't be too far off. Now that takes us to one of the ways that we can get there, and that's through this amazing vaccine program that we're seeing now reported in the news literally every day. The vaccine program that's going to be used to, well, first and foremost, prevent probably hundreds of deaths. I mean, that are going to be prevented by people having access to these life-saving vaccines. So I wanted to tell you, and I've got a little video coming up that will tell you a little bit about how vaccines were developed. It's only 3 minutes, and we're going to get to that in a moment. But before we do, I just want to say, you've seen that the province of Ontario, Premier Ford comes out and he talks about how the vaccine rollout is going in our province, and he's right about that because he does that part of it, and each provincial premier and their governments do the very same. But the federal role is really in three parts. First of all, federal government, with your tax dollars, has helped fund the kind of research that is necessary to create these vaccines, these life-saving pharmaceuticals. So there's been a lot of money go into this because of this global pandemic, developing new vaccines. Secondly, the government of Canada is responsible for getting quantities of these doses of vaccine. So procuring them, getting advance orders in. And Canada worked back through the middle part of last year to secure advance orders for these vaccines once they become available. And thirdly, Health Canada actually approves these medicines for use by Canadians. So making sure that the quality, the safety aspects of these drugs are there for Canadians and will do what they're intended to do. So let's now go to that. It's a really good it's a little piece that Health Canada did. Just one little caveat with it. This was done prior to the vaccines being approved here in Canada, but you'll figure that out. And once the video is over, I will come back and tell you a little bit about where we're at on vaccines. So
vaccines are the most effective way to prevent the spread of infectious disease, but developing one can be costly, long, and complex. However, with significant investment and collaboration at a global scale, developing a vaccine is possible in a much shorter period of time. So how are vaccines developed today? And will the development of a COVID-19 vaccine be different? All vaccines go through three basic stages of development: the exploratory stage, the preclinical stage, and the clinical stage. In the exploratory stage, scientists do basic laboratory research to find vaccines that can help us develop immunity to a disease before being exposed to it. On January 11, 2020, the genetic code of the virus causing COVID-19 was published. This allowed scientists all over the world to start working on finding potential vaccines. With more than 150 in development worldwide, scientists are using current approaches like using whole or parts of killed or weakened virus, and newer techniques such as delivering COVID genetic material directly into cells. In the preclinical stage, scientists use laboratory and animal studies to identify safety concerns before testing the vaccine in humans. It is also used to help find the safest dose. While many vaccine candidates don't progress beyond this point, successful ones move on to the clinical stage, where they are first tested in humans. This stage normally consists of three phases. Phase 1 trials involve a small number of healthy volunteers to test safety and confirm that the vaccine causes an immune response. An immune response refers to how our body recognizes and defends itself from viruses and other potentially harmful substances. Promising vaccines then progress to Phase 2, where they're given to hundreds of participants, including groups at risk of the disease. The goal of Phase 2 is to test the vaccine's safety, the proposed doses and method of delivery, and again, to assess the immune response. Phase 3 studies involve thousands of volunteer participants and compare groups that received the vaccine to those that didn't. These studies are used to further answer whether the vaccine works and still demonstrate that it's safe for use. One way scientists have worked to reduce the time to develop a COVID vaccine has been to use study designs that allow merging of clinical phases. For example, new approaches have allowed for Phase 2 participants to be included in larger Phase 3 studies, allowing scientists to shorten the overall timeline and number of participants needed, without cutting corners or compromising safety. The first COVID-19 vaccine trials in humans started in March of 2020. Since then, tens of thousands of volunteers have been enrolled in clinical studies worldwide. Health Canada, responsible for regulating the use of vaccines in Canada, has authorized clinical trials for COVID-19 vaccines. Before approving a new vaccine, they look closely at all the data on it, paying very close attention to its safety. Many vaccines will fail somewhere along this path if they don't work or are unsafe. It's normal, and this is the purpose of all the stages of development and clinical trials. Only those that are proven safe, effective, and of high quality will be approved for use in Canada. A safe and effective vaccine will bring us one step closer to the widespread and long-term management of COVID-19. Visit canada.ca/coronavirus to learn more.
So there's a quick little overview on how vaccine development happens, and the good news on all of this, of course, is this was truly an international project to with scientists working in different parts of the world to come together and find these. A number of different pharmaceutical companies have done tremendous work to speed the process of this up, and to the point where we're now, after all of this work that was described in that little video, all of the scientific reviews and the clinics, the trials rather, that have been completed on this, Canada has now approved 2 vaccines for use by people in our country. The first of those, and again, you've followed all this, so I don't want to go into a lot of detail on this, but the Pfizer BioNTech vaccine was the first to come out. It's the one that has to be super frozen, I think around minus 80 degrees Celsius in order to keep it stored. But there again, you had provinces getting the kind of equipment they need in place. I noted even last week, the Simcoe Muskoka District Health Unit had equipment sufficient that they could get the Pfizer vaccine to different parts of our county to make sure they could get the vaccine to long-term care homes. So this is the kind of thing that's happening as we speak. The second vaccine that was approved is the Moderna vaccine, and we're in the stages of getting that vaccine delivered to Canada as well. It doesn't require the sort of super frozen temperatures, I think around minus 20 Celsius, which is cold enough, but a little bit more, a little bit less stringent in terms of the logistics of handling the Moderna vaccine. They can move it out to more remote parts of the country. So both of these things are coming in quantity. They started to come in December. By the end of March, we're expecting to see upwards of 3 million doses having been delivered here in Canada and getting out to the priority groups that both the provinces and the federal government have identified. So let's go to that. And that's a big question. I mean, what's the priority look like to get these vaccines? I should just a brief mention here. When it comes to deciding what that priority looks like, this is going to be a decision that's worked out certainly between federal officials and the various health authorities of the provinces, in our case Ontario, but they work very closely together to figure out what does that priority list look like. So I can tell you, by and large, there's the 3 priority groups. First of all, will be residents and staff of people in shared living residences, like for seniors. Secondly, adults 70 years and older. They'll begin with adults that are 80 and up, and then gradually work their way down to about age 70. And thirdly, healthcare workers, and I say first, second, and third, but they're all in the priority group. So healthcare workers, especially those having direct contact with patients, and not to exclude healthcare workers who are working in at the home care level. So personal support workers, these are all very much in the high priority area. Included with that would also be adults in indigenous communities and in the north. So those are the sort of priority ones. By and large, hoping to see that whole population, for those who wish to get the vaccine, completed by the end of March. After we get past the end of March, we're into a time in 2021 where larger quantities of the vaccine will be arriving. And that's when most provinces, including ours, and you can see on the graphic there, when they get into phase 2 and 3 here in Ontario, we're going to get to more general population. I see even this morning, I think that was one of the federal officials from Health Canada who's overseeing the federal implementation of this, spoke in terms of seeing the general population starting to get vaccinated starting in the April to June period in much larger quantities. So that we can hope to see in the months ahead. So it's going to take some time, but I think we would all agree that we've got to get this first and foremost to the people most vulnerable and potentially the most likely to contract this killer virus. So on the graphic there that Ontario shows, I mean, you can see that's a plan that Ontario has, and they have a really good website you can go to check that. In Ontario, the Ontario COVID vaccination plan website will take you directly to that source. You can see exactly how many doses have arrived, how many have been administered, and literally on a daily basis, you can see that. The same holds true in Canada. There's a really good website to track the vaccination program sort of nationally as it's been rolled out in the various provinces and territories. And you can see that at covid19tracker.ca. I'm just going to take a bit of water here. There we go. Yeah, so there's the one. There's the one on Ontario. You can see that was as of today. Have 169 odd, and there's the national vaccination tracker as well. All right, so with that, I think we can go to questions now, and I hope we've got some questions here already. Excuse me. All right, let's go to our first question, and Doug is asking, when are seniors in Penetanguishene getting their COVID-19? Pardon me. And a raspy voice for some reason. So Doug, basically what you saw there with regards to the vaccine rollout, if you're in a higher priority group, if a senior's in a long-term care center, you can expect they'll be getting the vaccine fairly soon, and that'll be within the next 2 months. And if you're not in a long-term care center, depending on age, the older you are, the more likely that you're going to be part of that general vaccination program. So I would suggest what we should do there is go to the Simcoe Muskoka District Health Unit for details on just exactly what their sort of week by week plans are for that vaccination program. Excuse me. Duncan is asking, what about interprovincial driving travel? Is that restricted? Well, as I won't profess to be an expert on this, Duncan, but what we're saying is that you should be staying at home unless it's necessary to travel. So there's nothing illegal about traveling interprovincially right now. Some provinces, like down in Eastern Canada, there are restrictions on entry there, but certainly within Ontario, there's nothing illegal about traveling in Ontario or even crossing into Manitoba at the moment. But this is constantly changing. So what I would do is check if you're going to Manitoba, for example, check their websites to see if there's anything there that's restricting you from coming in as an Ontarian. Many people are asking, why can't the borders be closed and international travel stopped to help reduce the spread of COVID-19? I'm going to turn over to Curtis to maybe shed a little bit of light on that. I know he's been dealing with some of these questions as they come in from constituents. Curtis?
Yeah, so thank you, Bruce. The main reason, in large part, travel is restricted. There are situations, though, where the government has put some flexibility in place, and that's mainly been to allow essential work to continue. Essential workers coming into Canada or leaving Canada to go to other countries, as well as, in some cases, students coming to Canada for their studies. And then as well, there's been exceptions made for family members, immediate family members coming into the country. But in large part, a lot of the travel out in and out of Canada is restricted, and depending on what other countries are doing as well. We did see Europe bring in some restrictions for Canadians traveling over there as well. So, but the main bulk of travelers are restricted from coming into Canada, but the government has made some exceptions on compassionate grounds in some cases for family members coming into Canada to see sick or dying family members potentially. And like I said as well, essential work was the other main reason for the exemption.
Yeah, one of the key things there is that for those that are asking about this, and we certainly see the point. I mean, it's absolutely necessary to keep an eye on people coming into country. At the same time, we should be aware that let's um, we don't want to delude ourselves on this. This COVID-19 is in the community now, and it's being spread internally. So, pardon me, we have to make sure we just attend to that first and foremost. But the supply chain, that is the means for our grocery stores and drug stores to be supplied, depends on trucking routes to stay in place and shipments to continue to come across the border. Chris was asking about a question pertaining to their business. Received a liquor license day after the first lockdown. Because they weren't open in 2019, they missed the eligibility for some of the business support programs that became available, like SEBA and some of the other programs that are available. Chris, maybe check with us on that. Give us some of the particulars. We'd be happy to see if we could weigh in. You're not alone on this. We've heard from other businesses that have similarly come up against, and these are eligibility criteria. In some cases where you might not be eligible for one program, there might be others that would respond to your situation. So I'd ask that you give us a call and see if we can help you out on that. Excuse me. Jessica asks, laid off from COVID in March, lost daycare, no childcare, and now in lockdown, can't return to work as they're closed again, and all 5 children are home from school and childcare. So, if EI runs out. So one of the things you might think, Jessica, again, I'd ask you to give us a ring here at the office. There is a program called the COVID Recovery Caregiver Program, a benefit. So even if you're not eligible for some of the other programs, there's an ability to get some support for these very kinds of situations where you have to care for a family member or children. If there's a lockdown measure and they can't go to school, there are extra benefits for that kind of situation. So give us a ring. And if you're not eligible for EI, you can probably get CRB, but you may be also eligible for this caregiver program, and that would be worth looking at. If you want to have a look at it on the website, it's the Canada Recovery Caregiver Benefit. Charlene asks, Bruce, how much priority will staff and participants of emergency shelters be given to receive vaccine? Great question, Charlene. They are certainly at the top of the list and second phase. So I'll go back to one of the items I mentioned, people that are in restricted confined quarters will be in a position where they should be at the top of the list. Again, for specifics on that, as the vaccine becomes available, in our case, Simcoe County District Health Unit, Simcoe Muskoka District Health Unit, will be able to kind of, I may not be able to give you a time frame, but people in shelters, in confined quarters, sharing quarters, that kind of thing, they are very much at the top of the list for vaccine. James, does government have any end game for COVID? What percentage of the population needs to be vaccinated for us to have a more normal lifestyle? Excellent question. All of them have been great questions. James, as part of end game, I mean, you've heard probably or in read articles about so-called herd immunity and what percentage of the population has to be vaccinated before you get an effective tamp down of the risk of this disease. I've read anywhere from 60 to 75% of the population. So conceivably, we may not get there till well into later summer or September. The government has been clear in saying that they believe that all Canadians who wish to have a vaccine will be able to have access to that by no later than September. So that's a pretty good, pretty sound commitment, I would say, based on the deliveries and the quantities that are coming in. I'm inclined to think that may even go a little more quickly. Some things are unknown with that. We don't know, for example, what the percentage uptake is going to be of people willing to have the vaccine. But obviously, the higher it is, the better that people are going to be protected against this vaccine, or pardon me, against this virus, and that will gradually have an effect on fewer deaths, fewer illnesses, fewer hospital beds and ICU units being needed, and it becomes a major plank in our fight against COVID-19 over the next few months. Great question. Yvette, why are most blue-collar workers not included in the essential worker class, for example, electricians, plumbers, heating contractors? Interesting. Now, I mean, because Yvette is a key point on this. I mean, construction activities have generally continued through the course of this. I think based on what I've read on this, and it might be verified again by the health unit, but people who are in industrial workplaces and are part of the essential work stream obviously will be on tap to get the vaccine probably in that second phase of the rollout. That's probably, I'm thinking, sort of late March, April, early May period. As to the specific question around why contractors and people who work in construction aren't so-called essential, is not a question I really know the exact answer to. I'd want to take a close look at the provincial regulations. That's the sort of thing that is usually categorized provincially, and I'm sure it's on a website somewhere, Yvette. But we could dig that up, where they would define effectively what an essential worker is. The way we have it at our end, it tends to be people who are have to work necessarily to make sure things like supply chains, that the flow of goods and services, vital goods and services, stays consistent, that there's still groceries on our shelves and we can go to drugstores and get the medications that we need, that kind of thing. But there's all kinds of other work going on that is allowed and not too risky, where you're not having too many people in close proximity, where you can work safely. And construction is generally one of those. So that's great. Well, listen, we're getting close to the end here, and I don't know if there's any other questions over there, Curtis. I think we've got you on mute there. Maybe just, there you are.
There we go. We have a few others, but there are somewhat repeats of questions that we've already answered regarding when vaccines are going to be issued to specific sectors. So
yes,
we can definitely follow up with everybody afterwards if there's any questions that we've missed.
Yeah, that's great. I mean, those are, and very practical and important questions. And as I say, our the authority around that whole vaccine rollout, a question of putting up time as to when it's going to be there for certain categories of people, is something that will be the health unit probably has the greatest insight upon. But even for them, quite honestly, much of this depends on the pace of deliveries of vaccine as well. So I think the name of the game is for the short time ahead is to stay at home, obviously, and limit our travel as much as we can. And at the same time, be patient and try to work through and access some of these federal and provincial programs that will help businesses and workers get through it. And we'll just keep this up over the next while so that we can get back to our livelihoods and living in a way that we were accustomed to in the early part of 2020. So I just want to wrap up by thanking you all again for attending this Facebook Live. We're going to be back in February with another one. We'll have a little slide on that at the very end of the show. Remind you that our offices are available, and although we're operating right now in a very restricted because of the restrictions that came in today, our offices are not open for in-person work. We're doing most of our staff are working from home. They're taking calls, doing emails, making outbound calls, all from their homes at the moment. But all of our services by email and phone are being attended to, and we can make appointments for if it's necessary to do like a document or something of this nature. We'll make an appointment for you to connect with you to do that. You can reach us Bruce Stanton at bruce.stanton@parle.gc.ca or at 800-265-6228. And you can reach us there anytime. I want to thank David and Curtis, who helped do the show with us tonight. David's our producer, and Curtis, of course, was there to help me with the questions, and our moderator for this evening. We couldn't do these shows without both of them helping out in the trenches to make sure that we can do this properly. So I'll close off as I usually do by giving an incredible shout out to the amazing people in our riding and across Simcoe County who continue to be there for us with some of the burden they bear in terms of helping patients in whether they're personal support worker or they're working in a hospital. They're doing all the necessary steps to take care of people who have been implicated by this virus. It's just terrible and gut wrenching to watch how this has affected our country. Even more so to our friends in the United States. It's very, very difficult. And you just think of those healthcare workers and what they're doing to keep us all safe. We sure appreciate everything they do. So stay healthy. Try to stay off the roads as much as you can. Stay well until we see you next time. Good night and have a wonderful week ahead.